Earlier, President Cyril Ramaphosa ended the national state of disaster. Now, however, the focus has moved to health regulations that are up for public comment, which will move the responsibility for managing the COVID-19 pandemic to the Department of Health. In fact, the regulations go beyond COVID-19 and outline measures that can be taken by the health minister if the minister determines that there is a notifiable disease in circulation. The opposition DA and some lobby groups say if the regulations hold, the health ministry will be simply too powerful. Public participation platform Dear South Africa says thousands have logged on to register their protest. We're now joined by Dear South Africa Director Rob Hutchinson. Mr. Hutchinson, thank you for being with us. How many comments have you seen, have you received, and how many are pro and how many are against the regulations?
Good evening, Francis. Thanks for having me on. Yeah, we've received well over 186,000 right now, and it's climbing at an absolutely rapid rate. We've actually never seen a campaign climb as fast as this one has. As it stands so far, we're 97% of people of the 186,000, 97% of them say definitely no to moving the regulations to be permanent underneath the National Health Act.
What do you do with these comments? Is it at all part of the public participation? Because the public is allowed to comment on these regulations, I understand, till the 15th of April.
Yes, exactly that. So as people comment, they have their say. We're not running a petition of any sort. It's a proper public participation initiative where people can either say they agree with the regulations, agree with the amendment, or they disagree, and they're invited to give a reason as to why. Each one of those comments is delivered individually as soon as a person does participate, and then we deliver those immediately through the Department of Health, and then we also collate and record all of those so we have a solid case of evidence when something should go wrong. Should the minister or the department dispute the public participation, we keep a record of it and produce a report which can then be used in a court challenge at a later date, if necessary.
Okay, so you're acting as a conduit between the people who want to respond and government and a platform for this public participation. What are people complaining about?
It's obviously making the COVID regulations permanent is the biggest issue here, and the human rights violation involved in that. You know, a lot of civil society organizations, including ourselves, did fight quite a few of these regulations when they were under the Disaster Management Act. Those temporary regulations, even the ones that were withdrawn, have now found their way back into a permanent situation, underneath permanent legislation, which is the National Health Act. And that is a dangerous situation, which most South Africans have already realized. So it's not a protest against mandatory vaccinations or anything to the sort. It is simply an awakening by the South Africans to actually say, hang on a second, we can't have permanent COVID regulations, even if there isn't any reason to have them, even if there isn't a pandemic.
So let's just look at some of the things. I think it does suggest that the health minister can make vaccines mandatory if he or she wishes to do so. Masks outdoors come into play, restrictions on funerals and indoor and outdoor gatherings. All right, in fact, Mr. Hutchinson, please stay with us. We want to pause this interview because something is happening in Diepsloot. Let's go to our reporter, Mbalentla Mtetwa, who's there. Mbali, can you tell us what's happening right now? All right, in fact, she can't hear me, but really, it's hard to speculate. What we can tell you is that these are live visuals, and it seems like the police are involved in some sort of search operation. We don't know if these people up against the wall here are being arrested or not. Of course, the president has weighed in, and a lot of concern about the mob violence that we saw overnight, a Zimbabwean national being brutally killed in Diepsloot. The area was very tense after demonstrations around crime, with many residents saying police are not dealing with the matter. All right, let's go back to the health regulations that are currently up for public comment. So Dear South Africa is with us, saying that this would make some of the lockdown restrictions that we've seen permanent. I was outlining what it does require: masks outdoors, restrictions on funerals, indoor and outdoor gatherings, to a similar number that we've seen under lockdown level 1. Venues can take up to 50% capacity if people present a vaccination certificate or a COVID-19 test. Mr. Hutchinson, so in many respects it does look exactly like the restrictions that we've seen in level 1 that we've just come through.
Yes, exactly. And that is exactly the problem here. The President did talk about interim regulations that were put in place because the Disaster Management Act is no longer effective from midnight on Monday. But those interim regulations seem to sit under no piece of legislation, which makes them invalid at the end of the day. The law does allow for a cooling off period, a 30-day cooling off period, where certain regulations may apply, but shifting them completely to be permanent underneath the Health Act is the big issue here. And yes, you are correct. It is exactly the same. In fact, we can even go back to right to the beginning of lockdown when the regulations first came about, and we saw regulations which were completely unjustified, open-toed shoes and hot dinners and so on that were banned. We could be facing that again, and it's completely up to the minister or the Ministry of Health to determine whether the situation.
But Mr. Hutchinson, we can't go back to lockdown level 4, I think it was, because that's not included in the regulations. The minister responded earlier to journalists who said this does look like a copy and paste job of the regulations, but the regulations for level 1. So that's not about what you can buy or anything like that, or hot or cold food or anything like that.
Well, we must remember that the President in his speech also said that the levels fall away completely. So the levels no longer apply. And we've also seen that the levels were, there's no set science behind what level means what. We saw level 1.2 and level 2.3 and adjusted level 3. So it's really, it's a mixed match there.
What I'm saying is the regulations look like level 1, and it could be argued that maybe, yes, it's been copied and pasted. Or it could be argued that level 1 is something of a refinement. So government did see that there was pushback to things like you can't buy open-toe shoes, you can't smoke. And level 1 was kind of putting into place something that worked over time and didn't seem to affect our lives as profoundly as the higher levels. So couldn't it be said then that maybe level 1 is a good idea if COVID-19 becomes fatal again? It does put that power in the hands of the health minister.
Well, I would argue against that. If the situation does increase, if the spike, if there's an increase in infections and an increase in death rate, then the minister is well entitled to reinstate the Disaster Management Act. And that's a temporary piece of legislation. There's absolutely no need to move the once temporary regulations to be permanent under a permanent piece of legislation. So that is essentially our argument against the shifting to be permanent. The pandemic and any situation similar to a pandemic is temporary. It's not a permanent situation. It doesn't require permanent legislation at all.
In your experience, I think you said about 180,000 people have commented. Maybe it's going to get close to 200,000 or over. Could that shift the needle? Does government respond to those sort of numbers? Could the legislation change?
Definitely does. It definitely does have an impact. If government doesn't take notice of the public outcry and the voices against it, then we have the right to take them to court for ignoring proper public participation processes.
All right, thank you so much for your time tonight. That was Rob Hutchinson, Director of Dear South Africa.